Morena, Prime Minister, as always, thank you for your time on a Tuesday morning.
Morning, Jenny,
Can we talk about job seekers? Number of people on that benefit has increased by 8,000. You want to get people off the benefit, but right now, do those jobs even exist for those people?
Look, there's no doubt about it. We're going through a tough time. There are people losing their jobs in the last few months, as you've seen, and that's a function of actually businesses having suppressed demand and also high inflation and high interest rates. And so we appreciate that job seeker benefit is there for that reason. That it's there for the highs, for the lows of our economic cycle, and we're just coming out of a low now. That aside, Jenny May, what you saw in the last 6 years was a big disconnect between the number of people on job seekers and the unemployment rate. You had 3.2% unemployment, I think 60,000 more people added to job seeker. So, yes, we've got job seekers linked to the economic cycle, but we've also got to do a better job of actually getting people off welfare and into work. And that's why we've been putting more investments into case managers and also into these job plans, because actually sometimes what you hear is, someone came and applied for a job and actually they didn't have a driver's license and therefore they couldn't run an errand and therefore they didn't get that job. They may not be able, their writing skills may not be good enough, or literacy skills, so we've got to invest in that. They might have childcare challenges, actually be able to get to work. And so it's that case management that's more individualised, because every circumstance is slightly different. And also it's the job plans that then are tailored to those individuals to get them off welfare and into work and overcome the obstacles that are stopping them from getting jobs. So, we've got 4.8% unemployment in the context of the last decade or so. That's still pretty lowish, and we know that the economy is improving. But as the economy improves, people will come off job seeker, but we still want to make sure that we are really doing everything we can to get them off that welfare and into work, which is a much better pathway for them and their families ultimately. I
do want to come to that needs assessment shortly, but will people be expected to move for work?
Well, we have a separate setup, which is that we have obligations in place, because all we're saying to people who are on unemployment job seeker benefit is you need to show up and engage with your case manager, and for work seminars, you need to make sure that you actually have a resume, and you need to make sure that you show up for interviews. Each case is different. I'm thinking about some parts of New Zealand where people travel quite a long way into a job, say at a mill or a freezing works, and others that live locally in the town, and that is up to each individual. And so we will work with them on an individual basis. Some people want to move to secure work, others may not be able to because of their family situations, and we wouldn't penalise them for that. But what we're expecting people to do is to meet their obligations, and the vast majority of people do. What's been good to see is since we've put the obligations in the traffic light system in place, 52% more people are showing up and engaging with their case manager. 90% of people who are flagged as being in amber, which means are not compliant, get compliant within 4 weeks, and 90% of those that actually have been receiving sanctions don't have kids. So, that has helped a lot to make it very clear about what obligations you have if you are receiving a job seeker.
As you mentioned yesterday, you also announced a comprehensive needs assessment for up to 70,000 people. That includes increasing phone-based case management from 1,500 to 10,000. So who's going to be doing that work?
Well, we've already we announced that in July, and we've actually added those 10,000 folk into those case management roles, and they're actually working really well, Jenny May, with younger people. Obviously, the forecast, as we saw, under the previous administration, is that if you're a young person under the age of 25, for example, you're forecasted to be on a main benefit for up to 20 years. And the faster we make an intervention in that young person's life and get them confident to take on a job and feel supported to do so, that's really important. So the actual phone-based case management, what I've been hearing, and I know what Louise Upson's been hearing from the front line, is actually working really well, particularly with the young people.
But you're going to be increasing that.
Help motivate them and help them get to work.
Yeah, that's the goal.
Correct. That's what we have done. We announced that in July.
10,000.
Correct, and we announced the 10,000 in July that we want to do that, and we've been building towards that, which is good.
So who's doing that work? For those extra cases, who's actually taking those on?
we've employed people to take those jobs on and within MSD as their case managers to actually reach out to those people. We've now got, I think, 70,000 case managers of the 200,000 plus people that are on job seeker benefit. So it's just much more active management to make sure that actually in cases of young people where we want to get them moving off welfare and into work quicker, and in some of those more complicated long-term cases, we actually have the support in place to identify the obstacles that are stopping those folk getting off welfare and into work.
I've got a couple of other things that I want to get to. I want to talk about nurses. Now, last week, 770 nursing graduates were told by Health New Zealand that they didn't have a job. Do we have enough nurses in this country?
Well, we've made tremendous progress, Jenny May. As I've tried to say over the course of the year, we have a record number of nurses now in New Zealand. I think it's about 29,500 full-time equivalents. A number of them will be also part-time. But the reality of all of that is that, we've made tremendous progress. I think we've added almost 3,000 nurses in the last 12 months into the healthcare system in New Zealand. It's got the most number of nurses ever working in it, which is fantastic news. Obviously, Health New Zealand have a big recruitment drive for new graduate nurses going into the hospital system. But if you think about the healthcare system, there are also needs for nurses in aged care, in primary care, and also particularly in rural New Zealand. And so Health New Zealand is actually giving a $20,000 top-up to those other employers within the healthcare system to take on more nurses in those places where we have shortages. So, we've made tremendous progress in the recruitment, which is fantastic. Yes, Health New Zealand will take a number of those nurses, or a significant number of them, into hospitals, but there are also opportunities, and our job is to make sure those new graduates are aware of those vacancies and those opportunities across the broader healthcare system as well.
I actually think they are, because we had Alex Welton, who's a nurse graduate, join us this morning. She talked about aged care or rural areas and the potential for jobs to be there. She said that a lot of her classmates have family and kids, and cost can be an issue with moving into rural areas. She also says that some nurses are applying for non-nursing jobs or looking overseas. Isn't that a waste of knowledge and a waste of enthusiasm of people who want to help others within our healthcare system?
Oh, look, and as I said, we've done such a great job in 12 months after having had massive worker shortages for the previous 6 years. The fact that we've actually got 2,900 extra nurses into the system is absolutely fantastic. But as I said, we've got gaps in the healthcare system, but we've also now put in place recently incentives to, a $20,000 top-up to make sure that actually those nurses can get connected to those, or those employers can actually connect to those nurses and make them aware of jobs that are available. And yes, they may need to move, but lots of folk across New Zealand move to secure work and to secure a job, and particularly a starting up graduate. But what I just say to you is, I know it's tough, but the point is we're trying to make sure that we now start to get the nurses into the places where we actually need them, which is in the aged care community space and certainly primary care space as well.
Just finally, I want to talk about that Supreme Court ruling that came out yesterday, which upheld stronger Māori rights over the foreshore. How does that ruling affect your government's proposed changes to the Marine and Coastal Area Act?
Yeah, obviously it's a pretty new ruling. The Supreme Court overruled the Court of Appeal, which had lowered the thresholds around the legislation, which is why we were going into legislation to strengthen that back up to what was intended. But frankly, Jenny May, the court decision only came out yesterday afternoon. We need some time to digest it, frankly, and Paul Goldsmith will have more to say about that later. Yeah,
and when can we expect that announcement or that response to it?
Well, he's just got to read through all the judgments, which I know he started doing over the weekend and into this and yesterday. And so let's just let him digest it a little bit and understand exactly the Supreme Court's decision. It obviously was very quickly made after the Crown appealed, and they overturned the Court of Appeal decision. But in fairness to him, he needs to give that some thought and digest all of that before he has any further
before the end of the year.
Again, I'm not sure. Let's just give him time to digest the decision and work out what the next steps are.